Hello, my name's Sharon Allen. I'm Chief Executive at Arthur Rank Hospice Charity in Cambridgeshire, and I want to share a few things we've learned managing across the system in this pandemic time. We've been working closely with our CCG and our colleagues across the system to transform end-of-life care across the county. A big part of that has been expanding our hospice at home provision so that people who want to can die at home surrounded by the people and the things that they are familiar with and they love. We had to go at pace and we had to recruit people using video calls, using telephone calls, and we will continue to do some of this because it's proved to be effective. We have become much more digitally enabled as a hospice than I ever dreamed we would in such a short space of time. And again, we need to retain what's good about that, whilst we also move back to being able to provide face-to-face services where that's required. It will be, the word I'm using very much in the hospice is a blended approach, the same for people who are working from home, some of whom want to come back to working in the building, some of whom don't, and some of whom want to do a blended approach. They will work here 1 or 2 days a week and work from home other days of the week. We've also been fortunate that Hospice UK, our membership organisation, has put on some excellent webinars over the period where we've been able to learn together, ask questions, share experiences, get mutual support. And I think all of us should look to those sorts of membership or collaborative opportunities to come together, to share learning, to take a breath, to support one another. Taking a breath is really important. At the beginning, we all had to respond quickly to all sorts of different guidance and new ways of working. As a senior team, about 2 months in, we gave ourselves permission to just take a pause, to just not react to everything, to start reflecting a little bit more, and to just give ourselves a little bit more time to watch and listen and think about how we were going to respond to things. I think this is an important part of compassionate leadership, something we're very keen to progress across our whole organisation. As well as gaining learning from other people, we've shared learning. We've produced toolkits and guidance for our care home colleagues. We've done virtual sessions for GPs and district nurses and other healthcare professionals across the system about using the respect forms and about how to have those conversations with people and their families about what they want when they are facing the end of their life, how they want to be cared for, where they want to be cared for. So much learning for all of us. And one of the other things we've done is just try lots of things, seeking forgiveness, not permission. We have just done it. And most of it has proved very successful. And where it hasn't, where we've tried something or thought we needed to do something and then realised that wasn't the right thing to do, we've adapted at pace. So my takeaways and what I want for the future from this is for that collaboration, that spirit of working as equal partners across the system to remain, that sharing of knowledge, of being part of a community locally and nationally and according to provision and specialism, to be there to support us all to continue creating for the future.